All right, I'm a good listener. I've developed this skill over 30 years of practice as a certified nurse midwife and as a women's health professional. But what made me a good listener was something that happened to me when I was 5 years old. I got one of those dreaded stomach viruses where you can't keep anything in any possible way. And I got dehydrated, so I got carted off to the hospital. Never been to a hospital, never seen a hospital, had no idea what hospitals were about, but they decided to start an IV. And of course, I'm 5 years old, so they bundle me into a bed. It's not any ordinary bed, though. It's a bed with bars. And there's bars that go up the side, and there's bars that go over the top. It really was a glorified cage. And so the nurses put me in this cage. They've got my IV running. They're making sure I'm not dehydrated. They put me in isolation, so they walk out, they close the door, and they forget to give me the call bell. So what happens when you give a 5-year-old IV fluids and no call bell? Well, the inevitable happened. And of course, I'm locked in this cage. I can't get out. I can't ask for help. And the nurses come in, and the first nurse says to me, "Well, what did you do that for?" And clearly, she was not looking for an answer. So she and the other nurse get me tidied up, remake the bed, put me back in my cage, put the top down, walk out the door, close the door, and forgot to give me the call bell. So it happens again. They did not forget again, and I never forgot this experience. It's made me a good listener about what issues concern the individual, because I may have been being treated for dehydration, but I got more than I bargained for. As healthcare professionals, we all need to have skills for listening, and why are they important? Because skills for listening aid diagnosis. The best diagnosis is made by listening. They also are critical for ensuring patient safety, for communication between colleagues and coworkers, and for patient satisfaction, one of those things that drives healthcare these days. How hard is it when you're caring for people to be in the moment? How many of you keep your phones in your hand? How many of you make direct eye contact on a regular basis? How many of you listen with your heart, with your mind, with your full self? The way we express compassion to the people who come to us for care as healthcare providers is one of the things that builds trust. It means we see that person as an individual and we hear what they're saying to us. Then we're able to give them understandable explanations. Explanations that are understandable to them, not to us. Because they have to be understandable to the person who is hearing them. Sometimes in healthcare, we have to have hard conversations. I've had to tell people that they have breast cancer, that their baby has died, that their baby has malformation, that even though they thought they were in a monogamous relationship, that they have a sexually transmitted infection. We have to listen and know the people we're speaking to know how to convey information when we have these hard conversations. We can listen using a team approach. That means that we are colleagues. We are team members. We are all leaders and we are all followers. We have to listen to be able to lead well. We have to listen to be able to follow well. We engage with our clients as partners. And then each of us needs to be able to put boundaries on these conversations, a set of parentheses, so to speak, so that there's a beginning, there's a middle, there's an end, and it's directed in a way that people know where they are in the conversation and they don't get lost or feel like, wait a second, we didn't finish, which is often an occurrence that happens. The American College of Nurse Midwives has a saying, listen to women. And we're indoctrinated in it, I guess that's not too strong a word, during midwifery education. And it's a key precept of practice. Women are the greatest users of healthcare in the United States. They're also the ones who coordinate healthcare for other loved ones and who often provide care, continued that care, when it occurs in the home. When you listen to women, you hear the stories of health disparities that can be related to poverty. They can be related to race, to gender, to ethnicity, to language. There are all kinds of things. The American College of Nurse Midwives is particularly interested in women because we do women's health, but we need to listen to all people that we provide care to. So who is the expert? Who is the expert in your life? Who is the expert in your life? Well, you are, of course, right? Everybody assumes they're the expert in their own life until you go to see a healthcare professional who says, well, they're the expert in the problem that you're coming to get care for. And yet, we need to engage the individual as a partner in her or his care in order for that care to make sense to them and for it to actually work. We need to listen for what is said, and we need to listen for what is not said. We need to listen with our eyes as well as our ears, and with our hearts as well as our minds if we're going to be able to provide quality care to people. People who come for healthcare visits at any setting are more concerned with their life. And if you look at all of these things, we all have hopes, we have dreams, we have aspirations, we have things that we want, things that we're doing, things that we hope to do. We all have challenges, we all have history, we all have good things and bad things that have happened to us, but nowhere on just about anybody's map of their life is the state of my health. Because it's really not central to most of our lives. We take it for granted. Health is just part of who we are at any given time. So in order to partner for health, we have to actually meet people where they are. We have to see them as individuals. So I'm going to tell you a little story about a woman who came to my practice. She came for a routine women's health exam, and I will say that many people came to my office and the reason for their visit that was given when they made the appointment was not actually the reason that they came for the visit. That waited till we were behind closed doors. And she looked like she'd fallen on hard times. She was neat and tidy, clean, well-groomed, but clearly in some kind of a struggle. And early in my practice, I had read a journal article that suggested that a mental health evaluation should be part of every clinical visit. And so I had incorporated that into my routine with these basic questions. What's going on in your life? How do you feel about it? And what are you doing about it? And these three questions became the backbone of my practice because I learned so much information from them. And so when I asked this woman, what's going on in your life, she said, I've had some dental problems and I've had to have my teeth pulled. And she's got her hand in front of her mouth. She's feeling embarrassed. And I said, well, how do you feel about it? And she said, well, not very good. I don't have any money for dentures and I can't eat. I can't eat enough to hold a job because I keep losing weight and I don't have any energy. And I said, well, what are you doing about it? And she said, well, I've gone to the doctor and they just tell me I need dentures and nobody will help me. And so I asked her, has anybody written you a prescription for dentures? And she said, no. And so I wrote her a prescription for dentures that said for medical necessity. And she promptly got her dentures. And I ran into her several months later in our little town. And she looked well, she'd put on weight. And she came over to say thank you. And she pointed and she said, look, there's my new car. I got it with my job. Listening is what helps transform people's lives. We listen to understand. So we need to do more than just hear. We have to think about it. We have to process it. And we need to think about it not from the context of our life and our cultural background, but from the point of view of the person who we're providing care to. And then, once we understand what is actually needed, we need to act. So it's not enough just to have that light bulb moment. You have to actually carry that light bulb moment out. You need to go the next step. You need to ask those difficult questions that may be awkward. So why didn't anybody else give this woman a prescription? Well, maybe they didn't know about it. Maybe they didn't think about it. Maybe they didn't think to ask someone, can I write a prescription? I tend to do the opposite, which is just, I'm going to write it, and if somebody says they can't do it, they can tell me, rather than finding out first if you have permission. But there are a lot of awkward questions when you're in healthcare. You know, I went to my midwifery program in Brooklyn at the city hospitals of the, yes, great city of New York, and learned to ask a lot of questions. You know, are you sexually active? Do you use condoms? Have you had any sexually transmitted infections? These are common questions in women's health practice. And then there's the ones that you don't really think about. How are your bowels? I mean, talk about awkward. The first time I asked that, I'm like, I don't really want to ask that. I got very comfortable with that very soon. And it's amazing what, if you give yourself permission, you can ask someone. And the key is to be respectful, to phrase it in a way that's acceptable, and to understand what the right question is. So how do we know what the right question is? Well, first of all, we ask the person in front of us why they're there. What brought them to us? What is it that they're looking for out of this healthcare encounter or visit? Because it may not be the same thing we expect it to be. There are people who have cancer who are looking to be cured, and there are people who have cancer who are looking to make the remaining days of their life as positive as they can possibly be and have time to say goodbye to loved ones. Each person is the expert of their life. When we talk about making healthcare meaningful for individuals, we run into a cross purposes. Most individuals are functioning based on their individual beliefs, and many of us healthcare professionals are functioning on the basis of evidence-based care. And I'd like to introduce a new term today that's evidence-informed care, that we use the evidence to inform the care that we provide to individuals, that we use the evidence to set standards for care, not to standardize care. If we want every woman to have prenatal care, then we need to make prenatal care accessible, and we need to have standards for what is included in prenatal care. And then within the context of that prenatal care, we personalize it to every woman who comes through the door. And that is based on her beliefs in what's important, her beliefs about where is the best place to have her baby, her beliefs about who's the best person to help her have her baby, whether she wants a crowd or whether she wants it private. There's many, many pieces that come into this. But we want to make the healthcare meaningful to the individual. And we do that by listening consciously. As healthcare professionals, we are experts and we're able to talk. It's much, much harder to be silent, to ask the right question, and to listen. Compassion is a core tenet of providing quality health care. And the wonderful news is that compassion and professional practice are not mutually exclusive. They're not mutually exclusive in the least. And it's one of those joys in my life, having functioned as a nurse midwife in a very small town where I knew most of the people who came from me for care. And so in an emergency, I would try not to think about who it was, but I would also know who it was, and I would know what they were looking for in the care that they received. It is a little bit more of a challenge, but it's a worth it challenge. When we listen with intention, we can determine if somebody is peaceful or in turmoil, whether they are sleeping or they are sleepless, whether they're eating well or not, whether they're active, and what the state of their health is. All of those things together make us where we are on the continuum of health. None of us function in a health bubble. We are all of our life. So what's your style of listening? Thank you.